Good afternoon, and welcome to the Davies Use Case webinar being presented by Miami Children's Health System on Asthma Home Management Plan of Care. This is Davies Award Use Case for the Value of Health IT. My name is Simmons. I'm Manager of Quality and Patient Safety, and it's a pleasure to moderate this presentation. Question is promoting the use of health IT to improve the quality of healthcare delivery. HIMSS and advocates the integration of clinical decision support and best practice guidance, analytical data to analyze progress, and I enable patient safety tools for all healthcare organizations, clinicians, patients, and community members as vehicles for improved patient outcomes. The Nicholas E. Davies Award of Excellence is the pinnacle of the HIMSS Value Recognition Program. This award recognizes outstanding achievement of organizations from around the world who have utilized health information technology to improve patient outcomes and value. The Davies Award use cases have been peer-reviewed to validate sustainable, improved patient and business outcome resulting from health IT-enabled care delivery. It is my pleasure to welcome our speaker today, Laura Hernandez, who is the Clinical Information Specialist with Miami Children's Health System. We're responsible for supporting the documentation, extraction, compilation, and analysis of data. It is also responsible for optimizing patient care workflows as it affects information systems and department outcomes. Accountable for the preparation and delivery of compliance documentation to maintain meaningful use designation. Ms. Hernandez received her Bachelor's of Science in Nursing from Florida International University and a Master's in Science Nursing from the University of Phoenix. She is ANTC certified in informatics. And we're going to turn this over to Hernandez to go through her presentation, and welcome Lois to presentation.
Let's get started. Thank you for having me. Asthma is one of the most chronic conditions of childhood. 500 in Florida have lifetime asthma. It accounts for one of the most frequent reasons for hospitalizations, approximately 200,000 admissions a year. The reason so many hospitalizations are undertreatment and poor follow-up. In 2007, the Joint Mission set up 3 core measures related to asthma in order to establish a baseline for the treatment and management of asthma. There were 3 measures defined: asthma, or CAC, 1, the use of relievers, CAC 2, of systemic corticosteroids, and CAC 3, the home management plan of care. Measures and hospitals were compliant with the first 2 measures. The third was a bit more difficult to achieve compliance. In 2013, the Florida Department of Health issued a call to action for hospitals and providers in their writing of the burden of asthma. This call to action specifically called for an assessment of admission rates and compliance with the Asthma Home Management Plan of Care, or Action Plan. We had a slightly elevated asthma readmission rate, and our compliance CAC3 was approximately hanging around 75%. With the current inpatient readmission of approximately $6,000, we have 2 goals. 1, increase compliance with CAC3 from 75% to 100%, and reduce asthma readmission rates by 10%. A disciplinary team was created and comprised of respiratory staff, RN from different departments, physicians, IT, pharmacy, risk, quality, education, and parent advisory. Our advisory is a team of parents who are very involved with improving the patient experience. While not come to our meetings, we use some of their meetings to introduce the project, get feedback on the design of the form, and then show them the results of the design. I'll talk about 1 year from conception to implementation. Monthly team meetings were set up to review the workflow and make changes if needed. Our findings is that there was not a defined workflow for who would be responsible for creating the asthma action plan and then presenting it to the parents. This is one of our major contributors to our low CAC3 compliance. Another contributor was that the form was on paper and not embedded within our EMR. There's a product called Lighthouse. This is a dashboard display of a list of patients per unit with the criteria for the quality measure. The clinical specialist would review the list and discuss with the residents attending whether they met criteria and wanted to order the quality measure if not already been ordered upon admission. This was also used to determine if a corticosteroid and a reliever had been administered. You could visually see that they had already met those measures, but since the action plan was on paper and scanned in, there was no way to visually determine on this quality measure page if the form had been created or given to the parent. The work decided upon starts with asthma patient being admitted. The provider uses an asthma order set to order corticosteroids and relievers or determine why they are not going to administer. The quality measure dashboard was added to the order set to facilitate the ordering by the providers. The order set was the addition of evidence-based information from Zincs Health. This gives the ordering provider easy access to review any evidence-based information related to asthma treatment. Cropped view of our Lighthouse dashboard. You see the patient name, date of birth, financial account number, and room bed. Under inpatient and discharge, display whether a component has been met. If the component has been met, it will turn into a blue filled-in circle. The status lets the patient know that this patient meets criteria for this quality measure. The dashboard has not been ordered. In our case, it is the clinical specialist. Will select that have been assessed and ordered dashboard. You can also decide that this is not clinically relevant for this patient, and the will no longer display on the dashboard. Under inpatient column, once the reliever and steroid have been administered in the MAR, the green check marks display that the component has been met and the blue circle will appear. A red X will appear if it has not been met and the circle stays empty or half filled if one of the components have been met. One I had with this dashboard was that the discharge circle would never turn blue because there was not anything to link to it as it was on paper. The workflow. Once the form was made electronic, upon placing the discharge order, if there is no asthma action plan, they get a warning that this patient does not have an asthma action plan. There are choices the ordering provider can make. 1, document, which takes them to the electronic form to be filled out. 2, cancel the discharge patient order. Or 3, review reference documentation as to why the asthma action plan is needed. Lays on the reference link. It describes the rationale behind the asthma action plan and references in case they want more information. The down button takes you to the electronic form. The yellow boxes are required fields. This contains all the information that needs to be filled in to create the asthma action plan. It contains the follow-up appointment information, the specifics for this patient, and medication dosages to be given during an asthma episode. And it also brings in, via smart template, the drugs that were ordered in the medication reconciliation page. The asthma action plan had been completed, but reconciliation was completed afterwards or modified. They will alert that modifications have been made that affect the asthma action plan. They go back into the asthma action form and make any necessary changes. Here's our paper-based asthma action plan. As you see, it was difficult to read and not very parent or patient friendly. This one we took to parent advisory to review and give feedback on. This form looks like it contains all of the necessary information for the parent to make decisions based on their child's symptoms. It outlines information on what a reliever and corticosteroid is and does. All components that the Joint Commission stated needed to be part of the action plan. One of the suggestions made by the Parent Advisory Committee wanted a one-page form they put on the refrigerator. We did to place all of the most important information for the management of symptoms on the first page and all the patient education materials on the second. It printed two-sided. A component we added was the use of the traffic signal colors. Each coded section also contains words that say green, yellow, red for colorblind patients or families. Here it depicts compliance with our CAC 3 before and after the new workflow was implemented. Although the Joint Commission has since retired this quality measure, we continue to monitor it internally as part of our Clinical Excellence Index. This displays asthma admissions per month with the green bars. The orange line displays the readmissions for that month. We readmissions as a return to inpatient or option status within 30 days of initial admission date. Although a spike in asthma admissions in February 2016, we zero readmissions for that time. Here, asthma readmissions as depicted in a percentage per quarter. All our low percentages, there was a decreasing trend, which is what we wanted to see. Graph displays the readmissions by year. As you see, there have been a trend downward, and we not only met, but also exceeded our goal of a 10% reduction by reducing it by 26%. We can improve the asthma and readmission rates with more technology interventions, such as pulmonology, offering telemedicine services in the future. Value derived. This graph displays the total approximate amount spent on asthma readmission of $6,000 per readmission per quarter. Look at the financial benefits over 1 year by comparing the total spent on readmissions in 2015 and 2016. We saw savings of approximately $24,000. We increased our readmissions by 26%, and our CAC3 compliance increased to 100%, exceeding our project goals. What we found was that providing an asthma home management plan provides the information needed to manage symptoms and triggers to help empower the parents and patients manage their own care, to give them a lifeline with actions in case those interventions are not improving the symptoms. Time.
Well, that was a great and very interesting presentation. Just on the webinar today, and more use case webinars and information on how to apply for the Davies Award can be found posted at HIMSS at the Davies Award website at HIMSS.org/Davies. And